Welcome, everyone, to the Aspen Institute. This is kind of historic. This is a USAID-led event that is standing room only, which is great. So I don't know. I think it's because it's sponsored by the coolest group at USAID. My name is Peggy Clark. I'm a vice president at the Aspen Institute. We're delighted to have you here today. Thank you so much for coming. I think many others are trying to join us live stream, which they're trying to work out. It's not quite on yet, but for those of you that are joining us, welcome from elsewhere. This is a really wonderful report that we are just delighted to bring forward today, Investing for Impact. But most importantly, I want to give a shout out to our friends at the Center for Accelerating Innovation and Impact, particularly Dave Milestone, who's our acting director right here, who offered free Slurpees to everyone who attended this event. And so we know that's why you came. He's spiking them right now in the back so you can enjoy them in the reception. But all jokes aside, there's really powerful work coming out of the center that we have been really honored to be a part of in many of our projects, Aspen Management Partnership for Health and others. And somehow Dave and his colleagues managed to attract some of the most innovative thinkers in development assistance. And so we're really delighted to partner with them on any report they ever do. And this one in particular is really important and represents a kind of a sea change, particularly as it relates to global health. There's innovation happening in impact investing that we haven't seen anywhere else. And Natasha from Gavi, are you here, Natasha? Where are you? There she is. The Global Gavi, the Global Alliance for Vaccines and Immunization, was among the first to do an advanced market commitment around vaccinations, which I think in many ways was fundamental to these huge outcomes we've seen in terms of reducing under 5 child mortality and increasing vaccinations. And so that was really the cutting edge of this work around how we could use financing in different ways to address some of the biggest issues of our time. So we have a really fun day planned. We have some fantastic speakers. We have a panel of a very eclectic group from USAID, from the private sector, and from across the pond. Alix, who's here to join us, which we will engage in a lively discussion where we'd love to take all of your questions. But it's my really great honor to introduce Dave Milestone, who's the acting director of the Center for Innovating Impact Accelerating. It's a mouthful. Center for Accelerating Impact and Innovation, and it has to be in that order. Else you mess it up. But Dave is really at the forefront of believing in the possible in the work that we do. We're all here today because we believe in that. And so, Dave, we love working with you, and congratulations on this great report. Thanks.
Thanks, Peggy. As always, your Slurpees afterwards, so get ready. They're spiked and ready to go. This is a huge crowd. You know, this actually sold out in 2 days. Who knew global financing was so global health financing was so popular? I've never been to a Justin Bieber concert, but I'm guessing it's a little like this without the groupies and the glow sticks, but Peggy, we'll work on glow sticks next time. First, to start with some thank yous. Peggy, Katie, Janice, I don't know where Janice is, but thank you guys for being the best partners we can ask for. Your inspiration, constantly, your motivation, and we're so grateful to work with you. I also want to do a special shout out to Robert and Aaron from Dahlberg, who've been just tremendous partners in our work to bring human-centered design and business thinking into the global health bureau, and you guys have been great and such an important part of bringing this work to life. And then especially Joe and Priya, the lead authors of this work, who you'll hear from in a second. And most importantly, one of the most amazing people and colleagues I've ever had the privilege of knowing, Rachel Fowler. Who you should all get to meet. First get your Slurpee and then meet Rachel. But she is the straw that stirs our drink at CII. We're so lucky to work with her. But we're happy to be here launching this report. It's so, this reported toolkit and hearing from these leaders at the sort of forefront of this sea change in financing in global health And this work and discussion is so timely for a couple reasons. First, we have very ambitious sustainable development goals in front of us, but we also have an evolving funding environment here in Washington for various reasons. But we have so much success to build off of and learn from. For perspective, in 2015, donors and governments put forward over $300 billion towards global health. That's nearly 3 times what it was in the year 2000. And governments and practitioners have turned that money into impact on the ground. In fact, since 2000, we've seen 40% reductions in under 5 mortality, in new HIV infections, 50% reduction in malaria deaths. And so those are really great things that we can build off of. But things are changing. For example, if you look at the history of sort of global, are you not able to hear me? Am I too tall for this extension? As you can see from this chart, this is a look historically at how we funded development assistance in health. And you can see that domestic resources are growing due to unprecedented economic growth across Africa and Southeast Asia. We also see private investment in health growing, and we'll hear from Tim Ring later on the panel. Africa, for example, is home to the fastest growing healthcare markets in the world. But while from 2000 to 2010, we've seen a growth of spending on global health upwards of 11%, in the last 6 years, it's been less than 2%. And as a result, donor funding is becoming a smaller and smaller part of what we need to achieve our shared goals. And you can see here, just in HIV, TB, malaria, and maternal and child health, we have some big gaps to fill. But necessity, is, as they say, is the mother of invention, and this gives us a great opportunity to change along with this changing financing health landscape. It presents some great opportunities to do things more efficiently and effectively, but it requires new innovation, new partners, new skills and expertise, but above all, a willingness to adapt. And that's why we're so happy with this work, as it highlights and I think makes practical how we put this theory into practice, whether a new development impact bond, pooled investment funds, partnering with impact investors, or issuing guarantees. The tools and framing that we'll hear from Joe and Priya about in this guide move us from theory towards impact on the ground, with always a bias towards action and progress, which is what these panelists are all about, and which is why it's going to be so great to hear from and learn from all of them. So with that, I'll hand it off to the lead authors of this work, Joe Wilson and Priya Sharma, and as they set the table for this great panel later. Thanks.
So huge thanks to Dave and Peggy for the kind introduction. I'm going to let the audience in on a little secret. Dave had offered to buy any of the panelists a beer if they could sneak Slurpee into the conversation. Also, if you hear hot dog, man purse, or I forgot what the fourth one was, you know where it's coming from. Look, to echo appreciation to a few folks first, our distinguished panel, so excited for you to be here, and thank you for taking the time. As Dave had said, Priya, and to part-time co-author, full-time rock star Rachel Fowler, you guys are fantastic, so thank you. The thanks extends. There are so many folks, many of whom are in the audience from USAID, who were vital to the creation of this, not the least of which being our folks in our health finance technical practice group. I see Cami, our back there, who helps lead that ship. A number of people are driving the ball forward at USAID in terms of what we can do with health financing. And a part of that is conversation starters like this in Washington and with our folks in the field. So thank you all very much. So we're going to get to the main event shortly. And like you, I'm really excited for this conversation. We have a diverse blend of folks. We've got public sector, private sector, nonprofit, the whole spectrum, and we also have people who have managed different types of capital, right? We've got people who have managed a significant tranches of grant-based financing, equity investments, and everything in between. So if you're going to have a conversation in D.C. around development finance at this point in time, it's worth getting some diverse and deep perspectives. So we're really excited to get that going. To help kickstart that, we're going to continue on with this little scene setter here and touch on and unpack just a couple of the main pieces that we talk about in investing for impact. So let's see if we can't get this thing going here. Okay, so Dave had shown you that historical trend piece, right? So investing for impact really covers three high-level pieces. One, what are the health financing and development finance trends writ large over the last 15 to 20 years, since the turn of the century? Two, considering those trends, what are the new opportunities? What are the emerging themes that are starting to underpin this new financial landscape? And then three, taking a concerted look at what the donor community is doing. Development finance is changing the way that foreign aid is distributed. So what are the implications for an organization like USAID? And Priya is going to dive deep into that as well. But to topic number one, as Dave had articulately pointed out and the statistics had confirmed, we've seen some major changes in a relatively short period of time. I mean, if you just look visually across this, you're seeing a significant increase in development finance. So this is all financing, in totality that's going to and within developing countries, right? So leading the way is domestic public resources. I mean, there's no doubt about it that this has been led and will continue to be led by the domestic sector. So, how do we as a global community start to reconfigure the way that we operate to allow them the tools and frankly, in some spaces, the opportunity and bandwidth to just go do it themselves? Second thing, and this always comes up in these circles, right? Where does the private sector play a role? Here we're talking about the private sector in two dimensions. One is the international capital that's flowing to these countries, and three, the localized capital markets that are becoming an increasingly significant player in a lot of the countries that we focus on and care about. And then the last thing, and to echo what Dave was mentioning about some of those incredible statistics, with that relatively small amount of money over the last 15 years, the development community has done what Bill Gates calls arguably the greatest achievement in the course of human history, which is effectively have under 5 child mortality, effectively have in 15 years malaria mortality, reduce HIV by 35% over 15 years. I mean, it's remarkable, and that line really has been the tip of the spear in accomplishing that. So that brings us to today, right? And we have really been struck by today's landscape and how it really reflects this all hands on deck type of approach. Public capital, private capital, the interplay between the two. And if we're just going to amuse all of us here for a second, if you're going to lay down on a horizontal plane a spectrum of capital that you wanted to start mapping where public capital and private capital starts to fall, right? Traditionally on the right side, you've got profit maximizing firms in the private sector that are operating over here. And according to old antiquated approaches, the public sector is kind of sitting over there, and there's this strong bifurcation between those types of resources. So the argument here is that thinking is really obsolete, right? That nowadays it's a much more diverse and eclectic blend, and people have varying interests, social interests, financial interests, and rarely do you see a clear articulation of where there's a tension between those two. In fact, oftentimes pursuing social impact allows you to drive financial return. And we have the CEO of a significant medical device company here who can speak to, what his firm does, as well as some of his additional efforts to accomplish those goals. You have folks on the public side. You have folks in the donor community who are not necessarily doing business as usual anymore, right? We're looking to be catalytic in the way that we fund our work and crowd in additional sources of capital. So it really is, on balance, this new and very complicated and nuanced field. So we're just going to talk quickly about 3 emerging themes. Theme number 1 on the left side of this spectrum is around development assistance. David mentioned we have development assistance plateauing, and it's becoming a smaller portion of the broader pie. So how to do business differently. Development assistance is doing business differently. We're seeing clusters of activity in particular around conditional funding, which encompasses a whole range of tools, but things ranging from milestone-based payments to development impact bonds to debt swaps to conditional guarantees. You're seeing a concerted effort to move away from financing solely inputs to moving towards paying for outcomes and paying for impact, which is really promising. Secondly, you're seeing a great deal of catalytic funding, and Priya is going to give a couple of examples of this in a second. But how do we not, as a development agency or as a donor community, how do we avoid having no cost recovery from our annualized investments? How do we crowd in maybe matched funding or use a small amount of funding through things like guarantees to leverage additional private capital? So there's a lot of tools that we have at our disposal to do that, and you're seeing more and more interest in this new landscape to make those things happen. On the other side of the equation, you have the private sector. And we could talk for an entire hour about the interest of medical device or pharma companies in sub-Saharan Africa or in India, but it's already clear. We understand that the interests over time are continuing to align, right? Those Venn diagrams are starting to overlap. So you've got commercial investors who are doing things that actually derive a great deal of social benefit and things that are akin to what development agencies are supporting as well. As you move down that spectrum, who here's, just a quick show of hands, who here is familiar with socially responsible investing, what we mean by that? Fantastic. And that speaks to the evolution of how this conversation has moved forward. But we touch on a couple of statistics in the report, but socially responsible investing encompasses about $8 trillion of U.S. funding. That's about $1 in $5. So it's a significant amount of resources. And within that, impact investing is a smaller slice, but it's also a very critical piece as well. And when you see these pieces on the commercial side and the public side kind of come together in the totality of where we're at right now, you see a lot of transactions, a lot of interplay. We don't have time to get into constructs like blended finance and innovative finance and public-private partnerships and things like that at length today. But rest assured that they are there and becoming more and more of a central focus of conversation, particularly in DC. So I'll leave it with one point that we had discussed in our little pre-meet. I just came from Chicago, and we had the Impact Investors Summit, and Sir Ronald Cohen, who's really been the leader of the pack as it relates to private capital for public good, had talked about the evolution. And in the 19th century, he spoke to the fact that private capital was really just interested in returns. And in the 20th century, it added this dimension of risk to it, right? It was risk and return. And now, ever since the late part of the 20th century into the 21st, now impact has really become a critical and inextricably linked component of financial return. And so that's exciting to see those changes, and I think I'll leave it there. But Priya, over to you.
Great, thank you. So Joe and Dave were too tall, and now I'm too short. So just very quickly picking up on the themes that Joe and Dave were previously describing, I think it's important to emphasize that none of these are really new. Development finance landscape hasn't changed overnight, but it's something that has been happening over time. And USAID and other actors like our distinguished panelists that we'll hear from later today have been adapting and reacting accordingly. So I think just to emphasize, USAID has traditionally and is still making a lot of investments in the areas around domestic resource mobilization and private sector engagement. And this PEPFAR's Sustainable Financing Initiative is a really wonderful example of how both of those are kind of coming together. Very briefly, SFI is a 3-year initiative to deliver on an AIDS-free generation, and it provides support to new and ongoing health financing activities to increase domestic resources for the health sector. And it works in using some combination of the following types of interventions. One of them is advocacy. So how do you generate evidence to sustain political will so governments will actually allocate more resources to health? Tax administration and policy. So how do you increase tax revenues either through improving tax collection or implementing new taxes? Improving technical efficiency through commodity procurement, supply chain system strengthening, management reforms, and then private sector engagement, which is really, looking at how we can encourage private markets to increase options for care provision, private sector health insurance, and also just in general greater private sector participation. But as Joe mentioned, USAID has also been looking towards this kind of more expanded spectrum of capital, and we have a number of tools that I'll walk through in a minute that can be used to catalyze additional sources of funding and then also improve the efficiency and effectiveness of the resources that we have to date. 2 examples of these non-traditional tools and approaches are the Grand Challenges for Development model, And the example that I'll walk through right now is called Saving Lives at Birth. So very briefly, the Grand Challenges model is essentially a way of crowdsourcing for new and groundbreaking solutions. It uses flexible seed capital to allow early stage innovations to develop proof of concept, with the ultimate goal of catalyzing private investment in these innovations and helping take them to scale. It's an example of the catalytic funding that Joe had mentioned earlier. So very briefly, in 2011, we launched our first Saving Lives at Birth a grand challenge, and the aim was to source for innovations to save the lives of mothers and babies around the time of birth. And one of the first innovations to receive funding was something called the ODON device, and this was the first device to assist with obstructed labor since the forceps were developed many decades ago. And the $250,000 seed grant that the ODON device received was used to perform small-scale clinical trials to test the efficacy and the safety of the device. And all of this was done actually under the direction of WHO. And as a result of the evidence generated from these clinical trials and the high-level attention that Saving Lives at Birth was able to give the ODON device, Becton Dickinson actually came to the front and said that they were interested in continuing the development and supporting the launch of the ODON device. And this is ongoing work that continues today. So it's a great example of how USAID was actually able to catalyze private investment in an innovation that has the potential to save the lives of millions of women and children around the world. The next tool that we have is something called the Development Credit Authority, or the DCA, and this is a really highly effective tool that USAID has had since 1999 and has enabled us to unlock $4.8 billion in private capital for development purposes, and that's a B, not an M. I think in health, it's a particularly powerful tool if we think about some of the barriers that many of private health providers face, which really is a lack of access to working capital. And without this working capital, many private providers are unable to expand the type of services that they provide. They're unable to hire new staff or maintain an adequate stock of commodities. And all of these can lead to poor health outcomes in many of the countries in which we work. And the DCA can help address this issue by enabling commercial banks to extend loans to traditionally underserved sectors like health and education. And it does this by de-risking, by sharing the risk of default with the bank and reimbursing up to 50% of the value of any defaulted loan. So it's a very powerful tool that USAID has been employing effectively to date, and I think there's scope and room to potentially do more. I will just quickly note, because I think this is a really great statistic, the default rate across DCA's entire portfolio across all sectors is less than 3%. So I think it really just demonstrates the power of what we can do when we are able to go in as a public sector funder and help kind of show the power of the markets that we're working in. I'll wrap up very quickly, but just to say, as Dave mentioned, Investing for Impact is an educational resource, and the aim really is to summarize some of the trends that we've been discussing, but also highlight 8 non-traditional tools that USAID is currently applying that have enabled us to work across the spectrum of capital and also improve the efficiency of the funds that we have to date. I won't go through all of them since I know everybody wants to hear from our panels and not from me, but I will also just say that in addition to having these tools, there are one-page summaries for each of them that provide additional information. Why is the tool needed? How and when can it be used? And I think most critically, examples of how these tools have been employed in the development space, and where possible, we try to include health-specific examples, and then links to additional resources. So unfortunately, the hard copies are not clickable, but if you do go online, you can download and kind of click on all of these resources, and we really hope that, as Joe mentioned, this is an interactive kind of conversation starter, and there's a lot of really great information out there, and we try to sort of aggregate it all in one space. So the report is available for download if you didn't get your hard copy, and at this point, I think I'll turn it over to Peggy and our panelists and say thank you.
Come on up, panelists. Thank you so much, Priya and Joe. That was great. And Dave, thank you. I'm sure we're eager. What I love about working with the center is it's really practical and it's really useful. It's where the rubber hits the road. And so I'm sure people in the audience are curious about, how do I do a GDA? Who do I talk to about a GDA? What is a loan swap? What is a debt swap? How to get involved in these things? So fortunately, we have this wonderful panel that has a depth of experience in a range of these products that we can all learn from. So let me jump in and introduce my panel, which is terrific. First, to my immediate left, we have Dr. Jennifer Adams, and she's USAID's Acting Assistant Administrator in the Bureau for Global Health. We've already gone out there by saying we love all the actings. We want them to stay, so we hope that they will. But she's in the middle of a sea change at USAID, so we're hopeful to hear about how some of this innovative work will play out over time. But Jennifer has a really fascinating career within USAID, which I was honored to read about. She was the USAID Development Counselor to China in September 2008. So she was posted to Beijing. Before that, she was Mission Director for USAID in Brazil. She was Senior Deputy Assistant Administrator for the Global Health Bureau. She's had 20 years at USAID. When she was in Brazil, she initiated a really interesting, successful public-private partnership called Mais Unidos, which engaged the 50 largest American companies to support social entrepreneurship. So it sounds like you've been working on these issues for some time. So we're really delighted to have you with us. Thank you.
Thank you.
Thank you, Jennifer. We found maybe the most innovative people at USAID to join us today. And then we have Dr. Alix Zwane. Am I pronouncing it correctly? Okay, great. We're really happy Alix has been able to join us. She lives in London, but she also has an office here, and she's the CEO of the Global Innovation Fund, and she's had 20 years of experience working on development and innovative financing, in particular the evidence base that's needed to do some of these new products. She was the first employee and executive director of Evidence Action, which was a nonprofit that developed service delivery models to bring to scale. And under her leadership, huge efforts were accomplished, and especially in the safe drinking water space. She's also been involved in advocating for evidence-based philanthropy at Google and at Gates Foundation. And she has published in a number of places about this work. She's a World Economic Forum global leader, which is great to hear, and has a PhD in public policy from Harvard. So I'm glad your schedule allowed you to be with us. This is really wonderful. Thank you. Great. And then we have a wonderful person to the left of Alix, who is Tim Ring. And Tim Ring, I had the opportunity of meeting last year out at Aspen at the Aspen Ideas Festival, and he's a friend of Dave. So FOD always gets special VIP treatment here. But Tim Ring is a really interesting person. He's the chairman and CEO of CR Bard, and the co-founder and co-chairman of TEAMFund. And Tim has had a really long and distinguished career for CR Bard since 2003, where he had a number of different roles: Group Vice President of International. He was responsible for cardiology and electrophysiology. This is a major medical device company. Group President for, I don't even know what this means, but sounds really serious. Group President for Coronary Vascular Products.
You don't want to have
glad you're in that
let's
role.
put it that way.
And Bard Access Systems. Before that, he worked with Abbott Laboratories for a number of years. So we're really delighted to have your private sector experience. And then, interestingly, Tim's wife isn't here with him today, but the two of them together decided to found a really interesting organization called TEAMFund, which we'll hear more about, but it's really transforming equity and access and is particularly wading into those waters of impact investing in really innovative ways. So thank you. Thank you all for joining us. So let's jump in. Everyone get their questions ready, because we're going to make sure we turn to you to allow you to talk to our panelists and our other members. So one of the things, of the many interesting things this report talks about, is it talks about this as the golden age of global health financing. So I want to ask each of you, do you think this is the global age of global health financing? And what are the key milestones in your mind, in your own personal experience, that has us feeling that about it? Maybe, Tim, let me start with you.
Sure. I would say it's still at the beginning of that, and I think there's several dynamics that kind of making that happen. One is obviously in low resource settings, the economies are some of the faster growing economies of the world. I think some of the other dynamics as it relates specifically to healthcare is a lot of the grants and donations to deal with a lot of the communicable diseases and infant mortality and whatever have been pretty successful. So as a result of that, life expectancy in a lot of these regions has increased dramatically over a short period of time. And that's where the whole incidence of non-communicable diseases starts to become more of an issue. That's where we tend to look at our opportunities in the medical technology space. That's where you can use more technology to treat those kinds of things. So that's all starting to come together where the economies are emerging. The need, the healthcare need, the unmet needs are huge. And we're right at the beginning of the tipping point, I think, where some of the companies that can be established, funded, and created in these geographies can become more sustainable and profitable and fund themselves going forward. So I would characterize it as early, but clearly the light is there to move ahead.
We want to come back to this point. This is one of the most perhaps surprising or powerful things in this report, this idea of kind of turning development assistance on its head, where more funding is coming from countries themselves. But let me turn to you, Alix. You've been at Google, you've been at Gates. Are we in the golden age of health financing? And what are some of the milestones you see that is moving us in that direction?
Well, I think we're in maybe a liminal state of promise and potential. I do think that, am I not turned on? Sorry. We've made an amazing amount of progress, to echo what Tim has said. And now we find ourselves in this interesting time in which we need to do more with less. And we need to think about how to challenge ourselves to be catalytic users of public resources. And we also need to think about how to grapple with the fact that more and more poor people live in fragile places and in middle-income countries. So we'll need some new strategies for addressing those two challenges. Part of how I think we're going to be able to do that is by making public money more catalytic in its partnership with the private sector. So that nice spectrum that's in this report, the more actors that populate the middle of that and that can partner with others who are in different spaces along that continuum is how we will be able to make that happen. So I think actually you can think of some of what we need to do with public money as venture-style support for health investments in fragile places. But that won't look like traditional venture money. It'll be more patient, it'll be more driven by evidence of impact, and it will be thinking carefully about how to take risks that others cannot. Because that's how we can really create blended opportunities. It's kind of a jargony word, but it really just means there's some risks that we can take at the Global Innovation Fund. There's some risks that USAID and guarantees can take. The more that we stretch our muscles to partner together, the more we can ride out the doing more with less traditional public money, which is certainly, I think, a space that we all realize we're in for the foreseeable future.
So this is so interesting because we have a representative of the corporate sector, a representative of a hybrid between public and private, and then we have public sector here. And it's interesting, we just heard reference that public sector can be like venture capitalists. But let me ask you the same question, Jennifer. Do you think we're in the global age? And how do you see it from your perch?
So I think from a donor's perspective, and particularly from the perspective of USAID, the image of a golden era for global health resonates, in part because for many years, the health sector and the work that USAID has been doing in global health has received a lot of consistent support. I think particularly compared to some other sectors which have come in and out of fashion. So education, for example, or agriculture, where there were peaks and valleys in the support that USAID was able to offer to partner countries. There's been consistent support, and I think bipartisan support for global health. And I think that is partly because of an evidence base and partly because of a wide range of partners that have been built up in the global sector, including the private sector, over many years. And I think those relationships also lead to what is now an era of possibility in countries that 50 years ago would not have had the market development that would attract the kind of partners that now are attracted and beginning to move in and to be resident in places that were previously largely occupied in the global health space by donors. So I think I think we are benefiting from a long period of sustained support for the sector, and able to build on that for an era that would include a more diverse set of contributions and more innovation.
That's really helpful. So let's talk from each of your organizations, which are unique. We have USAID, which many of us know, and many in the room are from USAID, and then we have Global Innovation Fund, and we have Tim, your team effort in your company. From each of your perspectives, how do you fit into this new global architecture that we just saw described? And Tim, tell me from your perspective, how do you see yourself in this discussion in this report?
So for TEAMFund, which stands for Transforming Equity and Access for MedTech, looking in low resource areas, clearly there's huge unmet clinical needs. That's one aspect of it. But when you try to create a company and make that company sustainable, obviously it's got to be profitable. So we think that the development in the market, there's huge problems in terms of the scarcity of skilled healthcare workers. How can you deal with that through technology? Perhaps, which we're finding some interesting opportunities to invest in technologies where the use of artificial intelligence, imaging, mobile phones, et cetera, can really supplement and augment that skill gap in the healthcare worker community. So, we identify companies, and then the approach that we bring is a little bit, although it's kind of a venture fund in terms of the financing, with primarily equity, convertible debt, et cetera. Our view is that we also want a return, and we think that it's important for the companies that we fund, for them to be sustainable, that they are motivated to make a profit and so on. So that's important, but to build that out, we've also brought more of a medtech sector, almost Gavi-like approach, where we've got many multinational medtech companies. You mentioned BD as an example. They've done a terrific job there. And others, and not only do they want to come with money, they want to come with their people and their expertise. So we've developed a network of advisors that we use. So we have almost a private equity approach in the investments that we make. As these entrepreneurs scale and they run into issues, we're able to assist them with just about any business issue that they have.
So you're bringing financing to the table of different types, as well as skills and management expertise.
Absolutely. Right.
So let me just ask you, does this description of this architecture resonate with your experience? Do you see yourself in this architecture?
Yes, we do. And in fact, we fit very nicely. It's still very fragmented, right? This isn't like Silicon Valley, where there's, one person in a building that likes to do Series A, and 2 doors down there's somebody that does mezzanine investing. That doesn't exist here. So we think that this report in particular really capsulizes some of the funding continuum issues. And as it evolves from grants and donations to more self-funding mechanisms and behaviors that are associated with that, that's kind of where we are right now, but it's still very fragmented. I think the balance of how you define impact with a financial return is a challenge, and I'm not sure if you went around the room here, you'd probably have 15 different definitions of what that means.
Right.
So we try to break that down with every investment that we're going to make. So we have an effort led by my wife, Catherine Gleason, and we've got some people that help develop these impact papers around each investment that we're going to make. And then when we look at making the investment, we'll work with the entrepreneurs to say our expectation is you're going to adopt and incorporate these impact measurements in your reporting, so that we measure both the financial business returns you would do normally with any investment, but also their impact results as well.
And do you work with USAID, for example? And in what way would you look to a partnership with USAID?
Yeah, so you mentioned Friends of David, and so we've been around USAID. We think there's a lot of ways to collaborate. USAID, through David's been very generous in terms of networking us as we've built this fund out to people like people in the room and on the panel here. And that was a very important part of how we decided to architect the fund, where we actually incorporate a nonprofit and a for-profit into one entity. So they've been very helpful in helping us think that through.
That's great. We hope we can get into some of the real stories about what it really takes to do these kinds of partnerships, because I think we recognize that the people on this panel are really at the cutting edge of these kinds of partnerships. So Alix, how does your Global Innovation Fund fit into this architecture?
So I really appreciate that point about fragmentation. And I think that part of what the Global Innovation Fund was created by USAID and DFID to do was to be part of taking some of those steps to reduce fragmentation in this space. We all know that there's large pools of capital that are seeking deal flow, and there's entrepreneurs in African countries and South Asia who are starved for capital. And until we can have nice ways of making those matches happen, we are still going to be faced with less impact than we should have and less financial reward as well. But the critical thing that GIF can do, and that was part of the vision of USAID in DFID in creating it, is to take interesting, difficult, challenging risks that commercial capital cannot take, and frankly, that sometimes it's hard for bilateral agencies to take as well. So we are able to make investments in which we plan very carefully for the fact that we will not achieve commercial rates of return in what we do, but we crowd in other investors who are seeking those kinds of returns sooner than other entrepreneurs might realize otherwise. And so one of the things that means for GIF anyway, is that we really have to put evidence of impact at the heart of what we do. We don't have targeted around financial rates of return. We make grants as well as debt and equity investments. So prioritization of where we spend our scarce resources, meaning USAID's, meaning the US taxpayers' scarce resources, really has to be driven by evidence of impact. And that means the private money drives more social impact as well. And so GIF is somewhere in that messy middle of that continuum on that aid architecture that you described, that we saw in the report. And it's really our hope that by playing in that messy middle space and taking risks that it's hard for others to take on, who are at both ends of that spectrum, we can push more money towards evidence-based innovation faster. I do think that the health sector has really the opportunity to be a leader in this space, precisely because, well, measurement of impact, I'm not going to say that it's easy in health, but it can be relatively more accessible to get to agreed upon metrics in health than it can be in some other spaces. So I'll give one short example of a way that some of this blending can work, and I'll give it from actually the agriculture sector, which is a little bit messy. We recently gave a debt investment to a company in northern Nigeria that's called Babangona. And what this company does is provide agricultural extension and cooperative and wholesaling services to farmers growing wheat and corn in that region. And we gave our loan in local currency, essentially. We assumed the currency risk on the debt that we gave to this company. And if everything goes exactly as planned for Babangona and all the great things happen for them, we're actually going to make negative 8% on this investment. Now, negative 8% is not zero, right? So this is not a grant in that way. But by giving it this line of subordinate debt in local currency, IFC came along and gave a dollar-denominated loan to this company, 5 to 7 years earlier than they would otherwise have been willing to do. There's also a series of interesting impact investors in that senior tranche of debt. And so it's a really great lived example of bilateral money, but channeled through GIF, so acting in a more venture-style fashion, combined with DFI money, impact investment money. And here's what I like somewhat the most about this investment. We're funding a randomized controlled trial impact evaluation alongside our debt investment. And we've agreed on milestones with the company that if the social value of their program exceeds certain levels, we'll actually reduce the interest rate charged on the debt. So we're able to bring evidence still into the heart of both the decision to work with this company and the rate that we need to charge them on their capital. we need more actors that can do this kind of stuff and more practice collaborating when we all speak different languages. We have different requirements of return for our limited partners, and really to flex some of these muscles in this Bob and Gona investment style way.
Right, that's excellent. Those are great examples. So when was GIF created?
Yeah, some of the nitty-gritty about GIF.
Yeah.
GIF was launched in 2014 by USAID and DFID, and has since been joined by Sweden, Australia, the Omidyar Network, and the government of South Africa as funders.
And how much do you put out a year in investments, or do you hope to?
We invest right now about $20 to $40 million a year, and that's about a mix of about 50% grant, 50% non-grant investments. And one of the things I will say for bilateral donors is that in addition to us being able to venture-style investing with bilateral money, which can be hard to do from within the agencies itself, it's also a risk-sharing mechanism because it's multilateral and multi-donor in a way that makes it a unique opportunity to share risk and to share lessons when we're all sitting around the table together.
No, that's great. Excellent. That's great. So Jennifer, let's turn to you. How do you see yourself within this architecture?
Okay, thank you. Yes. I think there's a few points to make about where USAID fits in. Of course, USAID has been, for a long time, the biggest bilateral donor in health. So that history and that legacy, I think, leads into where we play into to this architecture at the moment. And I think one way is the critical role of being a bilateral donor, and being a bilateral donor that has always emphasized a field presence, has always emphasized its local staff, has always emphasized having people in country with a lot of local knowledge and with an institutional memory. I think that's hard to replace. It's hard to replace having that on-the-ground, in-depth knowledge that's built up over many years and that we have in our staff. So one way is just as a bilateral donor, as we have been participating for a long time. I think the second way goes to what Alix is talking about, and I think it's sort of a hallmark in global health, the rise over the last 10 or so years of these multi-stakeholder partnerships. And these are sometimes issue-based, sometimes on one or another disease, and sometimes on broader platforms. But in global health, you have multi-stakeholder platforms that bring together bilateral donors, multilateral donors, the private sector, civil society, both at an international level and at a local level. And some of those include Gavi, which was already mentioned, the Global Fund, and the Global Financing Facility. So as a bilateral donor, participating in these multilateral fora really gives, I think, another aspect to USAID's work, combined with the traditional role that we've had in the field, which I think continues to be very important. Yeah. And then lastly, I think USAID as a donor organization writ large and in the global health sector has made a pretty long-term commitment to both working with new partners, including partners in the private sector, and to devoting some energy and thought to a forward-looking, innovative agenda, including in financing. And that commitment for us is the center and the staff that we have in the center that we want to have working with technical experts who know a lot about one or another health problem or disease area, but need to have some way of linking out for that innovation and for that broader community. And I think we've made great strides with that in the way that the center and its staff have been integrated into the Global Health Bureau and connected with our people in the field.
No, that's great. So Jennifer, I need to ask you, and many others will ask the same thing. How do we think the cutbacks in development assistance in USAID, or can you anticipate? Because the work that we're talking about today is really cutting edge.
Right.
And so how do you think this will fare in the new administration?
So we're in a kind of uncertain time, but I think we might be getting closer to the end of the long transition period. The first step to begin to define that, and the first step to begin to know a little bit of the answers of what the administration's priorities and outlook will be on these questions comes when we get an administrator. And so we're hopeful that, in fact, tomorrow there would be a movement in Congress to vote the approval of our designated new administrator, who is Ambassador Mark Green. And if that happens, then he would be able to start work at USAID maybe within a week or 10 days. And so beginning to have some of that key leadership in place is going to begin to start to have a direction to answer some of those questions, and also to be able to liaise and provide our point of view in some of the big rethinking and looking at streamlining that's going on both in the government agencies and across the government and in the White House. And we haven't really had that benefit up until now.
Right.
So having that, I think, will be a big step forward.
Do you have a sense of how he feels about innovative financing?
So he was the ambassador in Tanzania. That was one of his roles in the past. And because of that, he certainly knows a lot about global health. And I think in some of the other roles that he's played, he seems to be very open to, and really want USAID to be open as well to a wide range of partners, including private sector partners, and to not be pigeonholed into a traditional donor type of role, but to see what, as a longstanding contributor in finance and in achieving development goals, USAID can do as a catalyst. So I think he will be open to this.
That's good. That's good. So let's move to talking on a little bit more personal level. I think, as you can tell from our speakers today, there's a lot of passion in this area, particularly as it relates to global health and as it relates to this kind of cutting edge work. Tim, what's one thing you're really passionate about right now that you're very excited about in this space?
Yeah, I would say two things. One, when we started this a couple of years ago, if you would have asked me, what I thought one of the bigger challenges would be, it would have been, the pipeline of companies to invest in and whatever. That's not been the issue. We have a database now well over 800. There's ones that we look at all the time coming in. I think what's interesting, when you take the challenge that I mentioned earlier of, the lack of a lot of skilled, trained healthcare workers around the world with these huge unmet needs, a lot of the entrepreneurs are finding ways to take advantage of technology and trying to solve that need without having to think about, if you think about in a developed market, there's a lot of mouths to feed, especially in the U.S. fee-for-service environment. And when you start to get into newer technologies or innovations there's a lot of vested interests that come to bear relative to introductions, approval, reimbursement, whatever. When you're in an environment where you don't have any of that, and something is a lot better than nothing, being able to take advantage of cutting through and using some of the technologies available today to solve some of these problems is pretty exciting. And we think, frankly, has the potential to jump an ocean into more developed markets as you look at some of the challenges that are faced in the healthcare systems and the cost of maintaining these healthcare systems in the developed markets. So that's kind of exciting to see where that could go. And
So are you involved in some specific work on that right now? Specific?
Yeah, so we funded an Indian-based diabetes company called Janicare, and they take advantage of a mobile phone technology. The nice thing about that is it's really a platform. They've got some proprietary technologies that can move into other cardiovascular-related disease states. They have a coaching app such that, part of taking care of a diabetes patient is the discipline over the way they live their life, right? And being able to take advantage of a mobile phone, not only can you get the results, but you get instant coaching feedback as to what the patient can do during the course of that day or the week to adjust or change some habits relative to exercise, diet, et cetera. So, and again, some of their technology, they're working on an interesting congestive heart failure type technology which is a challenge everywhere for clinicians as they take care of those patients. And as you see that, I think the imaging technology that's, if you think about it, in the pathology area, which is a big need in a lot of these geographies, they don't have them. But if you can get a database large enough of multiple images looking at pathology slides, this is, this isn't, this is maybe, and you can get that diagnosed through the cloud with artificial intelligence, again, that can cut through a lot of different skill sets that it would take years to train people to be able to do that.
That's huge. You're really hopeful thinker. Alex, what about you? What are you most passionate about right now?
Oh, I'm really passionate about the potential for multi-dimensional measurement of social impact to drive where investment flows. I mean, I was talking about evidence at the core of the GIF model before, but for me, what gets me really excited is making this measurement of evidence of impact practical, portable, accessible, useful, and having it be part of a self-reinforcing system of innovation, not just a tool for accountability and holding people's feet to the fire. And my hunch is really that that's possible, and it's also going to be how we get closer to social metrics being integrated and really in one with financial metrics. So one investment that GIF has made that gets really close to living this value for me and that I'm really excited about is a program called No Lean Season. And this tackles the problem in northern Bangladesh of anticipated seasonal famine that happens in the north every year. And some Bangladeshi economists several years ago now, 6 or 7 years ago now, noticed the puzzle that during this predictable seasonal famine, people didn't send family members to other regions to look for work. And even though there were jobs available, so you had this labor market arbitrage opportunity that wasn't being exploited. Instead, you had seasonal food aid being brought to this region. And he did this experiment that said, well, what if I gave people bus tickets? If you gave the landless poor bus tickets and encouraged them to go see if they could find a job and see how that would work. And when they ran that experiment, for people who took up the bus tickets, the average impact for the family members left behind was 600 calories per person per day. So for those women and kids, that's going back to 3 meals a day from 2. And they were able to do cost effectiveness calculations that suggested this could potentially be far more cost effective than food aid could be. Now, is this controversial? Maybe. Are there lots of other things that need to be worked out in terms of general equilibrium effects? But it's a kind of really tantalizing example of measure things well, consumption in that case, try things that are experiments, and then see if there's service delivery models that go with them that I think are the kind of things that really energize me about the role of evidence in pivoting private or public money going forward.
That's so interesting. You're coming from 2 really different perspectives, but you're intersecting this really hopeful place. So I think most of us think of that evidence as it relates to social impact bonds and performance-based financing and those kind of streams of work. But you're talking about it in a more profound way, which is that I think you're saying that evidence is a piece of, for example, the example that Tim gave. Is that what you're saying? You see this as a really big part of expanding this field of innovative financing?
I do, actually. I think it's at the heart of expanding innovative financing. And that's partly because we want to use public money to unlock opportunities for private capital. And we want catalytic opportunities for aid money to be deployed to crowd in private money. But if we're going to do that, we want to crowd that money and push that money towards places where we can generate the most social value. And we want to maintain for the public resources that real commitment to social value as one of its highest priorities. And so that's where we need to get serious about measurement. And we are serious about it. I'm not saying that we're not serious about it now, but we can challenge ourselves to do things bigger and bolder than we have done in the past so that we can explain more clearly to all of our stakeholders what's the value for money of the investments that we're making.
Right, that's terrific. Jennifer, what about you? What are you most passionate about right now in this space?
Okay. I think one of the things that we're very excited about at USAID, and in part it gets to your comment about the fact that actually doing this is hard work, and it can take a long time. So after at least 18 months of work on the part of staff in the center, we're very close to launching a partnership in Rajasthan in India that is a kind of a pay-for-success model. And so this partnership involves USAID, it also involves Merck, it involves the state government of Rajasthan, it involves UBS and USAID implementing partners. And the idea is to work in an area where the maternal and neonatal mortality hasn't improved in the way that it has in some other parts of the country and in the way that in some ways was expected. So it's a model that brings together these partners to look at how to improve the care, particularly in facilities for women and children. And it uses an accreditation model that makes sure that these investments can be captured to have facilities that are that have life-saving commodities, that have trained staff, and that have good procedures in place, and to provide the financial and technical backing to make that possible, but to set the funding up in a way that pays for achievements and pays for success. And it's something that took a lot of discussion among all of the partners. I think one of the things you have to have if you're going to be involved in this kind of space is good listening skills. Not just good talking skills about what it is that you want to do, but good listening skills about what the other partners want to do. And so I think we're all very excited that this is about to come to fruition.
That's a great example. That's great. So I want to open this up for questions soon, but I want to just close this formal part of the panel with a question that's sort of called Name One Thing, and this is a little bit of a game. And so, Tim, let me start with you. Can you name one thing that donors like USAID could do to increase private investment in global health?
Yeah, I think if you, I don't know the page of the book, but there's a spectrum of the various investments and stages of investing and the likely characters that would participate in each stage. You know, we talked about the fragmentation there, and I alluded to Silicon Valley and the VC world there. That doesn't exist here. So bringing us together in forums, I had an earlier discussion this afternoon with someone who they actually fund early stage medtech companies. That's not something we would do, but we'd be very interested because there's obviously been some diligence there. They've looked at it. We could take it at the next level, right? And then we could even alert through our connections in the banking world to a more traditional world, and each stage kind of de-risks that investment to a certain extent.
Right.
Bringing that together and making those ideas and potential companies to light would be one big role. I think the other role is, you know, we talked about, maybe not to this audience, but some fairly sophisticated definitions of ways to finance companies. You'd be surprised at how little the entrepreneurs know about those avenues of investment. I'll just give you an example of one. I talked to a very interesting entrepreneur, not early stage, ready to commercialize this year, interesting technology. And we got into a discussion about convertible debt. They didn't know what it was, right? And this is the CEO of that kind of company. So not only on the funding side of things, but on the receiving side, educating, you know, hey, these are all available to you, and here are the risks associated, and the benefits of one versus the other based on your stage, I think is also an important role that USAID
can play. So do you think the whole intention to public-private partnerships is taking us there, to that place you want to go, where you're actually putting partners together in a way that's effective, or what more could they be doing?
Yeah, I think I don't get so hung up on the term public public-private partnership. We just kind of look at things that we think make sense, and whoever can help us or solve those problems with the companies we're investing in, we're glad to talk to those people to see if we can either co-finance,
Right.
co-invest, help develop, whatever the case may be. But certainly there's a lot of, use an expression sometimes, a lot of dirt flying, no holes being dug. And there's a lot of that going on in the space right now. We talked
Yeah.
about where we are. Is it a new era, whatever? It's still, I think the panel agreed it's pretty early on. But to the extent some of those things can be defined and brought together, I think is a role that governments around the world can bring to bear, in addition to capital.
In addition to capital, yeah, that's great. So right back to you then, Jennifer. For you, name one thing that governments in the private sector, that private capital needs to do to increase trust in the sometimes skeptical development community about private capital. What kind?
A couple of things. One, they could make sure they tell everybody about what great partners USAID are and how valuable we are to everything they want to do, and make sure everybody knows about that. And that would be helpful. And in addition, I think we appreciate the fact that private sector partners are showing up, and we welcome that, and welcome an honest dialogue about motivations and goals, because I think if you don't talk about the difference between the motivation to be working in global health between the private sector and the public sector, you're not going to get to a common position, and you're not going to get to mutual understanding. So I think a willingness to sort of face those stereotypes and get beyond those stereotypes is important, and it's as important for the donors as it is for the private sector.
So you guys are kind of modeling that right now on both sides. So you're sitting in the middle, Alix. So what do you think governments in the private sector should be doing more of together? Name one thing.
I think it's talking and listening more. You know, we're going to have conversations with people who we have different vocabularies and different priorities and different risk tolerance and red lines and bright lines, and talking more about those things, listening more about those things, and fostering more spaces for those conversations. I think echoing what you were saying is a really important role that I think USAID and others can help us, push us all towards.
That's great. That's wonderful. So let's open it up. We're just running a little behind, but I want to make sure we have time for as many questions as we can. So this gentleman right here has his hand up. We'll pass the mic. Tell us your name and your organization.
Hi, I'm Chris Dickey. I'm with the College of Global Public Health at NYU. And I really want to thank the panel. I've learned a ton in the last hour. It's been an amazing panel. My question is, I'm really intrigued by Joe's slide of the increasing domestic resources that are being mobilized for health in the countries that we operate in, and the fact that the development assistance from outside is flat. And so to me, that says that the internal capacity to allocate those resources is incredibly important. And I'm wondering how important you think that competency gap might be in the countries that we work in, and what is USAID doing to address that competency gap of making investment cases, of allocating resources? And
Great question. Anyone want to take that?
So I can say that it is a great question, and there's been, I think, a little bit of a learning curve on the part of USAID and in the health sector on that. And some of it has to do with the fact that our traditional partners are the Ministry of Health. And so we're used to dealing a lot with the Ministry of Health. And one of the things we've learned over the past few years is that we also have to have partners in the Ministry of Finance. And that sometimes the conversation between the Ministry of Health and the Ministry of Finance can use some interlocutors. And that it's important for the Ministry of Health to be able to develop the kind of capacities that you're talking about, and not just always ask for more, but to begin to think a little bit about efficiency and some of their own internal procedures. And I think we're very sympathetic to that, because we have to do the same thing. And so kind of trying to build more of a bridge between just the technical side of the Ministry of Health, but a little bit more on the administrative side, and particularly on the financial side, and the relationship with the financiers government-wide in those countries has been very important.
That's a great question. I also want to use this to give a shout out to Kirsten Abate in the back there, who runs Aspen Management Partnership for Health, and Phyllis of the UN Millennium Dave, who are working on a project that's explicitly addressing this question of investment in the management capacity of ministries of health. But it's a really important question. There isn't a lot of investment. I think it's incredibly hard to do. So, so I appreciate that question. Thank you. Others?
Can I jump in on that
Please,
one quickly?
yeah, please.
I think there's a big innovation agenda here too. You know, sometimes we act as though the private sector and will be taking on such a large role that it will be increasingly irrelevant what's capacity in the public sector. And it's important to say, actually, we're under no illusions about the need for continuing to strengthen the ability of the public sector to deliver services. There can be innovation to help us to solve that as well, which is why we do need, again, financing that can make grants to partners who can work with the public sector. And we need to challenge ourselves to say, well, how can we make it easier to deliver services in a capacity, in the context of limited capacity, and to experiment and take risks in contexts in which there's limited capacity? That's important too.
Risk taking, that's again your point about de-risking. Other questions, and also we can ask our colleagues Priya and Joe as well.
Hi, I'm Lee Grossman with the Forum Institute. I'm going to piggyback off this gentleman's question a little bit, because it's amazing to me, as identified in your report, there's $8.7 trillion available for social impact investing. So, and I'm thinking, why, and if you could, again, respond to like one, what is the most limiting factor in why there isn't just droves of people running towards that money, because it's a lot, and it could create a lot of impact. Why isn't that happening? Is it primarily a dearth of good ideas? Or is it, I mean, what is that one just barrier that we need to break through?
Great question for everyone. Tim, you want to take it first?
Yeah, so I think some of this revolves around a couple things. So there's a lot of capital, you could say, in one regard, right? What the expectation is of that capital is a question. And it gets back to that point of impact versus return and how you draw those lines. There's not great definition around that. It varies by entity, might vary by person within those entities. And I think that's a real challenge, so that's part of it. The other part of it is a capability. You know, from our perspective, as we look to invest in companies, I mean, you got to start with, it's like you invest in anything else. What's the business model? Is that a sustainable business model? Is it just a great idea, or have they built a plan and thought around actually achieving that and executing against that kind of plan? You know, a lot of these low resource settings and the people that live and have and grown up in those settings, they haven't worked for multinational companies, so they haven't been taught a lot of those kinds of things. So there's a huge leadership gap there as well. So, you know, normally, you know, money works kind of interestingly, and you want it to be successful, whether it's a grant or an investment. And there's a huge capability need around that, including the alignment around governments. Of, are you going to train your healthcare workers and make it part of your protocol in your system? Are you going to pay for it? Because for these ecosystems to grow and be sustainable, someone's going to have to pay for the healthcare, right? Very investment as an investor, very important from an investor's point of view. So it's a lot of different things, but that's how I would characterize it.
Alex, what do you think?
I think that there's a range of really compelling sources of social value that don't match well with some of our traditional investment vehicles. So when entrepreneurs need to build the market that they're selling into, they may need more patience and a longer time horizon to begin to deliver interesting financial returns than traditional closed-end funds can really work with. It may also be the case that, the social value that's generated is happening in a country context in which country risk means that commercial investors are looking for very high rates of financial return that just aren't compatible with what's feasible for that entity to deliver. And that's exactly why we need to have blended financial instruments that are available to support those entities that have very high social value and financial returns that may happen relatively slower or at relatively lower levels compared to what's traditionally compelling for commercial investors.
Right, that's great, great point. We have another, did you want to jump in? And we have another question. We can bring the mic back there. Did you want to address the challenges point? It's such a
I
good
think
question.
it's a ton of money. It sounds like a lot, and it's at a macro level, that question makes a lot of sense. When you break it down a little bit, I think you've also got the fact that, as I think others were saying, that in a country-level environment, you may not have a great enabling environment for public-private partnerships in the health sector. Part of that being a reticence on the part of maybe somewhat newly arrived private partners, including pharmaceutical companies that are just starting to really set up offices across Africa. But you've also got some suspicion, at least, or in some parts of the government, and particularly in some ministries, where they're not comfortable with the idea that they could set a regulatory environment but actually pay a civil society or the private sector to be the service delivery organizations, even in areas where they're not really doing a good job. They don't always feel comfortable with that kind of a model. So part of it is, I think, building upon the base and advertising some of those successes.
Question.
Thanks. Yeah, I'm Andrew with a London-based NGO that's called the Ecological Sequestration Trust, or Resilience.io. I wanted to ask sort of a general question about the challenge of financing larger impact projects, or perhaps say like combining asset classes, could be urban transport infrastructure and real estate, like sustainable real estate together. So I guess the question is sort of like types of catalytic projects that that multilateral development banks are already participating in, but in terms of actually tapping into the investment community, which say historically at least has been limited to smaller ventures, still necessary, of course, I don't deny. But so if you couldn't tell, I have an urban planning background. But yeah, so in the context, I know that there's a recent participation with the fund with like a really cool startup called Where's My Transport, an urban mobility wayfinding app. But so I guess on that within that realm, if you could speak to the challenges and opportunities with a higher scale of types of projects. Thanks.
Yeah. Alix, is that one to you?
So, I mean, I think one thing that we can all really challenge ourselves around is collectively in the development sector, our love of pilot projects that never fail and never scale, and think deliberately about how we are going to make sure that promising investments have a path to additional sources of financing during that phase of business model development, service delivery model refinement. We've been talking about it as de-risking. I mean, I'm not sure at some point what's the difference between de-risking and scaling. And we need to challenge ourselves to do a good job of supporting that whole process. And maybe it's different investors do that at different stages. That's some of what we've been talking about here. I think you're making the point that actually maybe we can do that in other interesting ways by combining elements of the value chain together into making a different investable proposition. So I think it's a very interesting point, and certainly could be something we add into our conversation and our thinking about helping that whole process and not getting, distracted by the next shiny new thing before we've really got the impact we're all seeking.
Well, that's a great answer. Does anyone else want to weigh in on that? And we have a question right here. Yes, please, go ahead.
I was going to go back to the last topic. So.
Please, go ahead.
Yeah. To sort of echo what the panel had said on the last round of questions, there's a way in which development agencies, I think, also have impact here, other than just on the de-risking point. So there was I think PwC a few years ago did survey of pharma executives about what their barriers were to entry into Africa, sub-Saharan Africa. And the points they made were lack of decent price points, lack of infrastructure, lack of HRH, lack of good supply chains, et cetera. So if you think about it, what a development agency does is also, especially in lower and lower middle income countries, create the stage where capital can come in and do its job. I mean, those are companies that have no lack of capital, but they have lack of other things that make it interesting, and I think that's also where we help.
Great question. Anyone want to jump in on that?
So just to say, I think that is a really good point, and I think you can see now in at least certain countries in Africa where the pharmaceutical companies are shifting how they do business, in part because it's a very different environment than trying to sell pharmaceuticals in Europe or sell pharmaceuticals in the United States, but also because so much work, at least in certain areas, has been done by the donors. And those models of working with faith-based organizations or working on sort of social and behavior change as part of an intervention, those work in the private sector too. So you can begin to see where some of the models that donors have developed and been investing in for some time can actually, I think, provide a nice entry point and a way of bringing the pharmaceutical companies and the private companies together in that space as a collaborative.
That's great. Yes, right here.
Yeah, I just have a small question.
Oh, okay, we'll bring the mic over here next, but you go ahead, and then we'll bring the mic here next.
My name is Bea Spadaccini. I work with USAID. I'm very happy that my colleagues put out this report because it is an interesting space, is investing for impact. And on a very small scale, personal level, the socially responsible investment and what can individuals do in investing responsibly. So my question is, like governments and different companies, even all of us here, how many of us actually invest responsibly? Because I think that Calvert Fund, Domini Fund, PACs, there's a ton of them out there. The performance is high, and yet it's difficult for individual investors to know enough about finance to invest in programs that actually, or in organizations, in programs that actually is aligned with what we do on a day-to-day basis. It's not easy, but as a lot of individuals, we could have impact as well. So I guess it's anyone.
It's a great question. I love that question. And let's take the second question over here, and that will be our last one for the panelists. Please.
Sure. Hi, Amy Lin. I'm from the Center for Accelerating Innovation and Impact. This is not a planted question. I think this conversation has been so helpful, and I think the interest in this event really speaks to the wider interest in looking at these innovative financing structures. You speak to the point of how important that listening and speaking is, and I think we're making a huge step for that here. I think the next step after that is what do we talk and hear, and actually scoping out a shared interest and a scope for investing together. And I think part of that is finding flexibilities on the public sector side as well as the private sector side to operate a little bit differently. And I know within USAID, sometimes we have our health silos and the color of money and regional barriers of working across different countries. And on the private sector side, it may be difficult to look at different metrics other than the bottom line. Or trying to think about how to bring shareholders along. So I was wondering if you could speak to your experience in working with these different sectors and finding that flexibility and that common ground to actually move forward together and get beyond the stage of just having shared momentum and goodwill, but really getting to shared commitments.
That's a great question. So both of these questions are about commitments. Anybody want to jump in?
Sure. I'll take that last part of that. That was one of the reasons why we created TEAMFund. Because, my day job, I run a publicly traded medical device company. There's certain profitability expectations that shareholders have that go according to that. And actually, the idea of TEAMFund was my wife's, who ran Morgan Lewis's life sciences practice for 28 years and retired, got involved in some impact investing, had gone to a couple of different events, UN and JP Morgan sponsored, et cetera, and came back and said, I see other types of industries there. I don't see any med tech companies there. And I said, it's because we're not going to make any money in a lot of these geographies for a long time. So, the challenge she gave both of us was, we've been fortunate enough to be successful in the industry. Why don't we try to do something about that? So I think that a lot of the multinational companies have supported us. They do it through foundations. When it starts to get into their P&L, it's a different discussion. But nonetheless, there's a passion and a commitment to try to do something to solve these problems. So we're hoping to bring that sector together, through TEAMFund and other related kinds of activities to try to solve some of the very issues that you're talking about.
No, that's great. Alex?
On this first question about individual opportunities for impact investing, I think that's on the radar and agenda of the World Economic Forum, certainly, and other international bodies. And people are taking on that challenge quite seriously. I was just at a meeting in the UK about that as part of something that is a whole of government initiative there. And certainly, so you've identified a gap that's there. One interesting case study on that front is there is an option in the French pension system to have your pension directed towards an impact investing approach. And that's something that we can all learn a little bit more from as we think about this interesting challenge.
Well, that's great. Did you want to have one more?
I think the question, I think it's a great question because I think it is true that we need some regular platforms and we need some ways in which it isn't just a one-off conversation, but you can build on that. And it reminds me of the example that that was mentioned of when I was in Brazil maybe 10 years ago. And at that point, we reached out to the 50 largest American companies, and we were saying, we don't hear about you doing much in the social space. And is there anything that we could do to help to catalyze that a little bit? And again, if you listen, you can be surprised. And they said, well, actually, we're doing a lot, but we're here in Sao Paulo, and the government is in Brasilia, and they never come here, and they never listen to us, and they never talk to us, and we don't know who they are. And we could help with that. So we set up a regular mechanism, and it did require some flexibility, and it required a commitment, an ongoing commitment, but it's still going today. So I think, again, if you try to be as flexible as you can for everyone's requirements and what's going to work for a partner in terms of their time and their location and for us too, what we can contribute. But I think you need to set up something that allows that communication to build over time. And nothing succeeds like success, right? So once you have a few things that you can share, it will attract other people. It's kind of getting the momentum behind that to have it go from one-off examples, which we have and which are very successful, to something that's more sustained.
Right. So on that note, we're standing between you and the free Slurpees. So I want to move to that part of the program, but I really want to give a shout out to the CII group for having the courage to put this report together. And I think the purpose of this report is for all of us to use it. And I've worked in this impact investing space for some time, and the array of the different types of instruments that are available is incredibly helpful. The array of cases that are there. I would like to invite this group to help us to fill that out more with other examples like the challenges and others. I find it to be really, really, really helpful. I think this is only the tip of the iceberg. And this group is taking us to a place where many others, not just the leaders who are on the front lines of this, but all of us can jump into this field. But please join me in thanking my panelists for their magnificent work. I think you all are really, really on the cutting edge of this, and we count on all of you and each of your perspectives to keep the torch, and also to thank the CII group for this incredible report and this work and for this event. Thank you. So please join us in a reception outside. Everyone, we'd love to have you enjoy the free Slurpees. That was great. You guys.